Hello, and welcome to another in the series of interviews of NCAP members, a series begun by Sharon Roszia, who is one of the, let's say, most accomplished and best human beings I've had the pleasure to know. And that's the truth. Now everybody knows. Sharon conceived of this series of interviews with NCAP members. She has been the interviewer for the series, and now it's time to listen to the master speak. So I'm going to interview Sharon for this one because she too is an NCAP member, and she too has a lot of important things to share with us. So I'm not going to do an intro to Sharon because she doesn't do that for other people. You can read her bio on the NCAP site, along with the bios of everybody else on the team. And instead, welcome, Sharon, first of all.
Thank you.
Instead, let's start by you telling us, let's say 5, feel free to go 4 or 6, 5 things that you really want people to know about you, your professional career, what you've done in the world of adoption and child welfare during the course of your career. Share away.
Thank you. Well, I've been at it for a really long time, probably longer than some of the people watching this are alive, have been alive. I came into the field child welfare through a public agency in Phoenix, Arizona in 1963. And I worked consistently for public and private agencies and private practice, writing, lecturing, traveling, leading programs, but doing a long time of frontline work. And I retired last year, just short of 60 years in the field. So I am in some ways a walking history of child welfare in this country. And I think that's important, and I'll touch on why I think that's important at some point. I've known for a few things, different iterations of those decades in the field. Probably the most recent would be the 7 core issues of adoption and now permanency, with that book with Allison Davis Maxon that came out almost 3 years ago, and soon to follow up a workbook to give people a chance to work through those issues, hopefully before they ever have children join their family. And I'm very proud of that work because it's focused on taking into account all the people touched by adoption: foster, surrogates, relative caregivers, birth first parents, the adoptee at all stages of life, even as their parents and grandparents, and all kinds of parents that are touched by the institution of child welfare. It's about normalizing and helping people come together and support each other and not have children have divided loyalties. It's about making adoption about addition and not subtraction. So that is a passion for me, and I certainly have been working on that since the 1980s with my pal and colleague, Deborah Silverstein. But I've also done years and years of work on rituals and ceremonies, really taking what's sometimes out there in the ether with our emotions and bringing it down into a way where we can process that, sometimes ourselves and often with others. And I did all day workshops on rituals and ceremonies at different conferences where people actually got to work on their issues for a full day with other people's support. That's still one of my highlights of my career. I'm also known for my work in open adoptions. And I'm not talking about semi-open, where things are done through post offices and so on. I'm really talking about keeping children's relations that are safe involved with their new family as they go into success into their adulthood. I started out looking at these issues, oddly enough, by being at a Staples here in Southern California, having a bunch of things run off for a private agency that I was working for at that time. And the gentleman came over and said, you know what? There's a lady over there and she's running stuff off too. The two of you ought to meet each other. And it turned out to be a good friend, a colleague, Mary Jo Rillera was her name at that time. She became Mari Rillera, and she was both an adult adoptee and a birth parent. And she had reunions on all sides. And we started talking, and we wrote a book together called Cooperative Adoption in the early 80s. And I can remember us traveling to conferences that were largely adoptive parents, and people were so angry at us. They were saying things like, oh, the mother of this baby was just an incubator. They would, I think if they could have, they would have thrown tomatoes at us. That was my introduction into beginning to talk to the public about the importance of openness. And I led a support group for almost 40 years for people who were involved in ongoing support, both first birth parents and adoptive parents, and sometimes pregnant women, and sometimes people were looking at adoption, sometimes adult adoptees. It was really quite important. The other thing I did was teach a course on sex and adoption. And I did that first time in Connecticut for the Connecticut Adoptive Parents Association. And that was close to 40 years ago, because how can you talk about adoption and not talk about sex? And so we had a wonderful all-day workshop on sex and adoption. And I think probably the most fun experience of my career was joining 2 Churchill Fellows from England in Australia for a month of traveling together to present adoption issues. One was an expert on international adoption coming out of Thailand. One was probably the premier person of adoption expertise in England at that time, and myself. And it was such a rich experience. And what it did for me is it opened up even further an understanding of what's going on all over the world and the different perspectives on adoption that people had. It was an amazing experience for me, and that was in the 70s. So I've been exploring and learning, and especially trying to learn from other fields, cultural anthropology and all kinds of science fields, and DNA, which is an area that my brother's an expert in, and trying to figure out how all pre and perinatal psychology, trying to figure out how all those fields contribute to us as child welfare specialists, because we're not isolated. We have to grab information from all around us and see whether it matches the truth of the work that we're doing and the messages that we're giving to families. Because after all, they're reading more broadly too. So we have to know that we're integrating our work with other fields along the way. And that's become a real passion of mine. So I hope that helps.
That's great, Sharon. Can I attend that class sometime?
Which one? On sex and adoption.
You figured it out. You've had, for anybody who knows you or knows about you, you've had a tremendous career. I think that something you can really look back at and be very, very proud of. But it isn't all there is of you, right? Something else rounds you out as a person. So tell us about, what are the passions, what are the interests, what are the things about you that are maybe less obvious, that people know less about, but that make you who you are?
Well, I thought a lot about that, because it's a lot of factors that I think back about the fact that I came into a family that was really intact and wonderful. And when I was very young, my father got polio, and he was in an iron lung for a period of time. And it changed his life, and it changed my parents' marriage, and it changed how I was related to in the family. And my role as the oldest child. I have a younger sister by 6 years and a younger brother by 12. And I had a very different role, because my mother had to take over a lot of the functions that our father would have done. And our father dealt with a lot of pain. And so there was a whole piece of growing up with somebody who struggled with pain and disability. And it's been an interesting facet of my own life, in that I have some autoimmune diseases that have greatly impacted me in terms of my ability to travel and move freely, et cetera. And so pain, internal and external pain, has always been a theme in my life. And I think maybe that's made me super sensitive to people's emotional pain from loss, from issues of shame. I kind of tune into it. I can almost see it around people. And I think it's because it was so much a part of my life. I can't ever remember a time that I wasn't wanting to volunteer to do things. Whatever organization was around me growing up, I had to be a part of it. I had to be a leader in it. I had to develop new programs in it. Always wanted to be a teacher. And when I went to college, I thought I was going to be a history teacher. And that's what I did in my undergraduate work. And then when I went into education, I hated the classes. I thought they were boring. And so I switched over to social work. And so what ended up happening, for a variety of reasons, I ended up getting my degree actually in psychology, but I've always functioned as a social worker. I'm a parent by birth, by adoption, and by foster care, not babies coming home, toddlers and teenagers. And I would say that my passion, because of my disabilities, not unlike my father's, because he was quite an athlete, and then he had to change his loves, his passions in life. So my passions are about museums and theater and reading and book clubs, things that allow me to not have to move so much, but continue to use my brain. As my mother would say, I was born with a good mouth and it just keeps going. So, that I guess that's a part of the gift as well. I'm not a superficial person. I'm not into small talk. I'd rather be by myself than just have an uninteresting dialogue with somebody. So I'm pretty left brain. I'm not very superficial, but I'm very passionate about things, and I'm a good listener. And I would have to say that the greatest gifts that I have in my life have come from the work that I've done. Lifelong friends, millions of children who call me aunt or grandma, who have stayed in my life over the years, birth mothers that I worked with 40 years ago, who have never really left my life. So Mother's Day is always interesting for me because, and since we just had it this last weekend, whenever any of you are watching this, I'm always amazed at who I hear from. So my career has been one of the most nurturing things in my life.
So with all that said, when you retire, you have retired. So we don't have to, this is not conjecture. What do you want people to think about you when they, Sharon, she, fill in the blank. What would you, what's the message on your gravestone?
My gravestone.
Well,
you never really retire, Adam, and I don't know, and I can say that I'm not doing what I used to do. I did over 400 presentations on Zoom during the almost 3 years of COVID.
Wow.
I do like to talk. And so
and people like to listen to you, or else you wouldn't get those opportunities.
That's probably so. But I would have to say that I got tired. It was getting harder, and I'm 80. I was getting a little tired. But I still consult occasionally with families who are looking for somebody with a long-term experience, both personally and professionally. I'm still doing some writing with Allison, but that's coming to an end. So what I'm doing, and it's a big part of my retirement, is I really have found that when you retire, you have a huge amount of knowledge that you have a desire to use. And there used to be a real feeling that older people had a store of knowledge that continued to be useful, so that old patterns wouldn't be repeated, that you could look at the history and see where we were and where we need to be going, and what kinds of little tricks of the trade we should do to get there. And so I am doing a fair amount of mentoring young social workers going into private practice around the country who say, I love this, I'm passionate about it, but I don't have enough information. Could you help me grow? And I'm loving that, because it's just tapping into what I can do and what I love doing. So I'm a teacher even now, but in a very different way. I've thought a lot about the fact that I think what I would want on my professional gravestone would be, she failed often. She did her best, and she never lost hope. That would be my legacy.
Not bad. A lot of us would take that for sure. As people watch this interview and learn more about you, what do you want to teach them? What do they want? What do you want them to take away from you? That, you talked about the wisdom of the years, basically, right? What are examples of that wisdom that you hope people can take away?
Well, one that I know you would say, Adam, and that is that this is a very complex form of family building. It's not just when you go to court, it's over. It changes family trees intergenerationally. It's very complex, that we will never know enough to know whether what we're doing is right. We just won't know, which is why we have to remain available for the long haul as professionals. So I start out with, for God's sakes, be honest. Don't recruit people with the idea that these kids are going to be great and all they need is a home. If you love them, it'll be terrific. Let's be honest about our kids, their trauma, what it's going to take to parent them, that they're going to be bringing their trauma and unpacking their little suitcases in your very healthy family. And then we get confused as social workers as to why that family doesn't look healthy in 6 months. Oop, did we make a mistake? Did we miss something? No, we need to be honest that this is going to impact greatly your family. So we need to be honest in our recruitment materials. We need to be honest in our orientations. We need to not make promises that we really can't keep because funding keeps changing. We need to do a better job of educating the professionals out there that are catching these children. They need long-term mentors, people that have been around for a long time. And there's always going to be something new. No two cases are the same ever. And we need a lot of research, and we need money poured into research, lots of money to support what we need to know. Everybody needs to know their biases, and they do need to do a check on their state of mind. And they need to take breaks when they really ought not to be working with other people who are having difficulties. And if you don't like working with a particular family, if you have your biases about religion or who's married to whom or whatever, you need to exit that case and let somebody come in who really can work fairly with that family. One of the things I notice all the time is that we're rushing all the time in our work. We need to slow down. We need to think. We need to take deep breaths and go, I just don't know. I need to consult with a few other colleagues here. When I walk into agencies today, everybody's hurrying, making decisions. I always say, do you ever just sit down and contemplate at your desk? I like how Adam's sitting right now because he's in a contemplative mode. And I don't think that we do that enough as professionals. We need to think things through. One of the things that I did every year, because I think it's one of our levels of success, is you can't help everybody and you're going to make a lot of mistakes. So you need to take care of yourself. You need to recognize you're going to fail, and that doesn't mean that you're a failure as a professional. But at the end of the year, and I've done this all my career, on New Year's Eve, I have a book of successes.
Oh,
and
wow.
in it every year is one child or one family that I absolutely know without me would not have stayed successful, would have disrupted from the placement, wouldn't have helped heal the trauma of the child, wouldn't have gotten the information and support that they needed, that I did something so important that I changed the direction of that family. That kept me in the field for 60 years. And I get that question all the time. How could you do this for so long and not burn out? That's because I know that every year there's somebody that I've made a difference to. And that matches my religious and spiritual perspective, because as a Jewish person, if you save one life, you save the world. And so I always feel like I did my world job this year. And here's the case. So I would encourage people to not worry about the overall of it, but to take each individual person and each individual family for where they are, treat them, and recognize that the work that we do, and it's so important to me to say this, we're destroyers, we're creators, we're guides, we're supporters, we're therapists, we're assessors. But the work that we do is not like any other professionals out there. We are attached to these families for a very long time. We are a part of their family's story. And this whole notion that we just send them away, that we've done our job, is forgetting the fact that we were with them at a most important time. It changed their lives, whether it's a child or a family, that we need to see our work as being involved with the community in a much larger way than we have traditionally in the past. And I am passionate about that. You can't take a relinquishment, you can't place a child, you can't change a family and say, oh, goodbye. Some of our families are going to be more involved with us than others, and that's fine. But it's really okay to go to a wedding, to go to a bar mitzvah, to be at the hospital when there's surgery, to be a family support, because we are part of their family story. And that's a very different kind of work than most people think about in other forms of social work.
Well, and I think maybe not all social workers understand their role in the way that you described it, but it's a wonderful prism through which to see their job, to see all of our jobs. So let's end it with, and feel free to add any other thoughts you may have, but you, like 20 some odd other professionals, accomplished people in your field, joined NCAP. Why'd you do that? And what do you think, what can we accomplish as a team, as an organization, as we go forward? We're still a very young organization, still a growing one. What are your hopes, your dreams, your aspirations? What's your guidance for us?
I joined it because I think the group of people that are connected to it are incredibly well-educated, deeply attuned to the needs of families, have access to doing the research that we need to support the work that we do. And I want to be a part of the party, because I think it's going to take a lot of us to move. Years ago, I must have been probably maybe even 30. I remember saying one day to a colleague at the agency I was working at that time with, this whole system needs to be blown up. Somebody should just come in and blow it up. And let's just start from scratch, because we can't reform all this. We got to start from scratch. It's just a mess from the beginning on. I think that this organization has the understanding and the passion and the intellect and maybe the power to make things change. But it means everybody has to be invested in it. Everybody has to give something of themselves. And we have to be willing to learn from each other. I'm still hoping there'll be money someday for just NCAP members to come together and strategize and come up with some goals and decide who's going to work on what. And I don't know that we've had an opportunity to actually form ourselves into a cohesive body. And that's why I belong. I want to be a part of that body. And I do think I bring something to the table that's important. But I'm also aware that every other person that's a member of NCAP is coming together with their own special skills and passions. And I want to know who they are. I want to know who to call. I want to know who has certain kinds of information. So I think what we can do is move the dial, but we have to do it as a very vocal, very present, very powerful, large group.
Anything to add? I think that was a good ending. But anything, Sharon, that we missed that you thought of? Okay, great.
No.
Great.
There is one thing, and you and I have talked about it, Adam, and I don't know if we want to leave it in or we don't want to leave it in, but I know we're very focused on NCAP members, and I understand the reason for that. But there's a whole other side of me that's aware that we have had pioneers in this field who changed things drastically already, some of whom have passed on, some of whom are old,